Hi, everyone. This is Ken with Ken's Insurance Agency. We're coming to you today to talk to you about Medicare. Um, Also, remember we're in Medicare open enrollment till December 7th. So you'll want to contact us as soon as possible to get your Medicare appointment so that you can know that your Medicare is fully taken care of for 2020. Um, we represent most of the main carriers and stuff, and we're going to be going over Medicare and some of the stuff that we use in our education. So let's get started. So, Medicare is healthcare for certain disabled people and for seniors. Medicare consists of Part A, Part B, Part C, which is also known as Advantage, and in some areas Select, then Supplement, and then Part D. You have a couple of periods for enrollment. The first is open enrollment, October 15th through December 7th. The next is a 7 month period around your 65th birthday. Starts 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. You also will have a special enrollment if you have credible insurance through an employer or through your wife's employer or your spouse's employer. Um, Once they retire, then you get an 8 month special enrollment from the time that that coverage terminates. Um, that you can enroll in your Medicare Part B and enroll into a Medicare plan. You also have SEPs. These are like when you're receiving Medicaid, also when you move into a new coverage area that your old plan is not covered by, if you move in or out of a long-term care or nursing facility. Also, if you have a chronic condition, then basically, if the companies in your area offer a chronic condition or offer dual enrollment, then you have options at help with this. Um, you can face penalties if you do not sign up for Medicare Part A, B, and D around your 65th birthday or if you let your coverage lapse. The only exception to that is if you have credible insurance through an employer um, that basically gives you the ability to not have to apply for B and D around your 65th birthday. Um, every year at open enrollment, your plan must be reviewed and updated accordingly. So you know that. Medicare Part A covers inpatient hospital care, skilled nursing facility care, long term care hospitals. Most people don't pay a premium for Part A. If you buy Part A, you'll be pay up to $422 each month. If you paid Medicare taxes for 30 quarters, um, for less than 30 quarters, your premium would be 422. If you paid Medicare taxes for 30 to 34, standard Part A premium is 232. We have not been notified of the update for 2020 as to what all these will be. As of 2019, your deductible is $1,340 for each benefit period. Um, and basically, a benefit period is being in the hospital for up to 90 days being released. And then if you have to go back in after the 90 days for a different covered event, then um, basically you would have to pay your deductible again. Same covered event basically goes into the same 90 days. And so basically, you go into your lifetime reserve, or if you've used up your lifetime reserve, you pay all the cost. Um, Days 1 through 60, after you met your deductible, is zero co-insurance. It's actually a copay, but they called it a co-insurance on Medicare.gov. Day 61 through 90 is $335 copay per day of each benefit period. Um, Days 91 and beyond is $670 copay per each day of lifetime reserve days after 90 days. And you get 60 lifetime reserve days over your lifetime. Once those are used up, then you pay all costs. If you have lifetime reserve days until they're used up, then well, once they're used up, you'll pay all costs also. So just be aware of that. Medicare Part B covers two types of services: medically necessary services, which can be services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. Um, the second type is preventative services, which can be healthcare to prevent illnesses like the flu or detected at an early stage when treatment is most likely to work. Um, you pay nothing for most preventative services if you get services from a healthcare provider who accepts Medicare assignment. Part B covers things like clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, getting a second opinion before surgery, limited outpatient prescription drugs. Um, and the standard Part B premium amount is $134 as of 2019. However, some people who get Social Security benefits will pay less than this amount. Your deductible is a yearly deductible with Part B, and as of 2019 is $180. Was met, you typically pay 20% for most approved Medicare services. Medicare Part C, also known as Medicare Advantage in some areas, also known as Medicare Select, is a plan that will cover your medical and doctor. So basically, it pays for both Part A and Part B. Is provided by a private insurance company. You must have and keep Part A and Part B. Usually includes Part D. Is very affordable price, can be anywhere from $0 to $100. It has deductibles, copays, and co-insurances, but it comes with extras like the ability for a free gym membership, which lets you get out and be around other seniors and also keep your health up. It also comes with a hearing plan, vision, dental, usually, and other things. Medicare supplements, a way to pay for your out-of-pocket expenses. You must have Part A and B and keep them. Cannot have Medicare Part C. Part D is sold separately, so that's an added cost. It's more expensive than Part C, broken into different versions: A, B, C, F, F high deductible, G, M, and N. And let's stop here for a second. C, F high deductible are going away in 2020. So as of January, you will not be able to get them. So if you qualify for Medicare now, you can still get them and be grandfathered in to where you can keep them. But these are the more expensive plans also. So just be aware of that. Also, when these go away, G will become the standard and there will become a G high deductible. They can have deductibles, co-pays, and co-insurances. Usually does not have extra services like hearing, vision, dental, and does not come with a free gym membership. Medicare Part D is your PDP or prescription drug coverage provided by private insurance companies. This part has actually changed for 2020. Now it is you must have Part A or Part B. So you must have one or the other, but you do not have to have both. If you have both, then great. Can be part of a Medicare Advantage, Part C, or sold with a supplement. Now, if you get it with a supplement or an Advantage, you will have to have both. If you have Medicare Advantage, you must buy it with the Part D that is included in the plan. Each Medicare drug plan has its own list of covered drugs called a formulary. Also, the formulary is broken up into tiers, and this determines the cost for each drug. Also, if a plan is going to remove a drug that you're on from its formulary, it must provide you written notice at least 60 days prior to the date the change becomes effective, or it must provide you a written notice of the change and a 60-day supply of the drug under the same plan rules as before the change when you request a refill. The cost or the payments you'll make on your Medicare drug plan are your premium, your yearly deductible, co-payments, and co-insurances, cost in the coverage gap. If you get extra help, you'll have certain costs there. And if you have to pay a late enrollment penalty or a penalty for basically too high of earnings, then you'll have to pay those. What determines your drug cost is the drugs you use, the plan you choose, the pharmacy being in the network, the drugs within the formulary as to where it falls, and whether you get extra help paying for your Medicare Part D cost. So that's basically what you got to look forward to. Both Medicare Part B and Part D have an IRMA that basically if you earn so much, then you have to pay extra cost for your income. Also, if you don't enroll, either when you lose creditable coverage or you retire, then you'll pay a late enrollment penalty also, and that's per month you go without creditable coverage. In 2019, the coverage gap cost will be no more than 35%. You'll enter the coverage gap once you have spent $3,820 on covered drugs. $1,100, you come out of the coverage gap and go into catastrophic coverage, which you'll only pay a very small co-insurance or co-payment. Then you also have other things that you can get to help you, like a cancer plan, critical illness plan, hospital indemnity, and a Medicare gap plan. Now let's take a look at another plan that you can get that is, I guess you could say, supplemental. We won't look at all the stuff, but it's a way to help offset some of your medical costs.
Our Real Money team is back, saving you a lot of money on your doctor bill. Americans, on average, spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service.
Hi.
But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money to take off from work, to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctors' office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
Well, it'd be $100 just to tell me that I got the poison ivy that I know I have.
Taking a picture,
I have the picture.
uploading it, and answering a few questions. An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits. In all, Phil's bill was about half of what it usually costs him to visit the doctor's office. And Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money!
Takes a little while to catch them, but when it does, watch out. Just look at Teladoc, TDOC, the world's largest virtual healthcare provider. We've been following this story for over a decade, ever since Teladoc was still a tiny startup. I've always thought it had an amazing concept. Let people have video conferences with their doctors. You shouldn't always have to go to the doctor's office to get medical care. Hey, sometimes you get sick when you go to that office too, let's face it. Not long ago, Teladoc came public, 2015. The stock quickly went into free fall, plunging from the 30s to the single digits in a matter of months. Since then, though, it's been a rocket ship, a deserving one. Last year, Teladoc more than doubled. It's up more than 60% just from 2018. Now we're in a situation where the results are speaking for themselves. Plus, just last week, the company announced that it's buying a competitor, Advanced Medical, and its stock shot to new highs. Let's check in with Jason Gorovic. He's the CEO of Teladoc, to learn more about this deal and his company's prospects. Mr. Gorovic, welcome back to Mad Money. Good to see you, sir. How are you?
Good to see you.
All right, I got to tell you something. You should be very pleased by what I'm about to tell you. I posted in this morning on my Twitter file that what are people's experiences with Teladoc. I have most people are very critical on Twitter. There was not a single negative experience. It was just positive experience after positive experience after positive. What are you doing?
You know, it's funny you say that. I used to run health plans. I got a lot of hate mail when I ran health plans.
I figured I'd get a lot of hate mail when I put your name up.
Now I get fan mail. Maybe not as much as
tell
you,
me
but
about
I get
that.
a lot
I love
of
this
fan mail.
contrast.
No, it's great. It's we're delivering care to people where they need it, when they need it, on their terms, right? And that's how the healthcare system should work. And it's nice. Consumers are understanding it. Payers are understanding it. Employers are understanding it. And we've been fortunate to be the beneficiary of that.
One of the tweets was someone got sick in the car, pulled over, called, got a diagnosis. Can it be that simple?
Oh, it really can. Yeah. I mean, you know, technology being what it is, we can now match a doctor with a patient in their jurisdiction where they're licensed, matched up with their specialty, and take care of them in a matter of minutes. And, you know, look,
Right. Now, it is 24/7. Also, this new acquisition to me makes you the worldwide leader.
That's exactly right.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of Teladoc doctors, 15 years. Average time it takes to get a call back from a Teladoc doctor for quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle. All right.
3.
Exclusive.
Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
You know, it wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi, thanks for seeing me. I'm glad you scheduled some time. How can I help? Make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle needs a dragon, huh? Arr.
They're finally asleep. How are you?
I'm good. I think we're gonna be all right.
Do you not have insurance for prescriptions? Not enough coverage or no coverage at all? Are you not getting the medicine you need for care because of the cost? Despite for almost a decade, chain pharmacies nationwide have been selling select generic drugs for as little as $1 per week, medicine cost is still a burden to households across the United States. Our program will lend you a hand. Now that you have access to the doctor with our teledoctor service, let's get the prescription worked out. If your insurance plan does not cover the cost of all your medications, or if you do not have insurance and you choose the cost-effective generic drug route, either way, our plan will drive down the out-of-pocket expense. Get discounts at over 58,000 national chains, regional chains, and independent pharmacies. Get 20% to 60% off retail prices for generic drugs and 20 to 40% of name brand drugs with no limits on quantities. Use mail order pharmacy as well and purchase up to a 90-day supply of your maintenance prescriptions. Our membership card is the gold standard for prescription savings. Enroll today. I know what the next question is about: vision. Don't worry, we have the answer. Your healthcare savings plan also includes 15% to 35% off normal retail prices for frames, lenses, and specialty items, such as resistant coatings and ultraviolet protection. Contact lenses and even LASIK and PRK procedures also receive discounts, up to 15% off retail prices as a matter of fact. This keeps money in your pocket should you need glasses, contacts, or ophthalmology services at any time. Just present your membership card and save all around. Enroll today.
Okay, that's all we can show you with Medicare, pretty much. We do have two others we could show you, but we're not going to show you them unless we're sitting down with you and talking to you. But they're add-ons also, so they're an extra fee. But you get all this and more for $49 a month and a one-time payment of $49, and that'll cover you and your spouse. And if you have dependent children, it will cover up to 2 dependent children, unless you're single, and then you can have 3 dependent children and yourself. So now, with all that being said, we cover Medicare in the states of Mississippi, Tennessee, Arkansas, Louisiana, Alabama, and Michigan. So if you're in one of these states, feel free to give us a call. We have most of the big name brand carriers, and we have some of the small carriers. So we have enough that we can take care of you for sure. So give us a call. Our number is 662-292-6271. You can also request an appointment off of our website, which is kensinsuranceagency.net, or you can go to our Facebook page and schedule an appointment by going to Facebook and searching Ken's Insurance Agency, or you can type in the address bar KensinsuranceAgency, and you'll be able to find us, and you can book an appointment through Facebook. Thank you. Have a nice night, and this will be posted on our social media pages, so you'll be able to review it and check it out, and be able to get more information on how to contact us. Thank you. Have a nice night, and look forward to helping you.